Okay, so if I could, you have had your opportunity to talk in small groups. Now is an opportunity for us to work as a whole group. So if you could focus up here. What I need you to understand is you do not have to agree with all of these cards. You do have to understand the intent. And even though every single person in here is a public health expert, and you may think you know what this group intended to say, the rule is only the group who submitted the card can explain what their intention was, okay? Good little thing to hold on to. So I'm just going to post them randomly. If there is any confusion about clarity, say clarification please, and then the team that posted it gets to clarify. So access to parks, decrease obesity, increase exercise opportunities in the community, improve nutrition knowledge, education, raise education level, improve health, childhood obesity, smoke-free ordinance, accessible, available fresh fruits and vegetables, comprehensive mental health care, mental and physical health care, lack of public transportation, teen pregnancy, parental readiness, obesity. Do you see any that go together as similar priorities for our community, Happy Town, to focus on? Okay, let's just try to keep them in pairs. Those were just all together and too obvious, but other pairs that go together.
Vegetables and nutrition.
Okay. What? Raise education level, improve health. Teen pregnancy, parental readiness, lack of public transportation, comprehensive mental and physical health care. Okay, so now looking at these, I want you to look at your remaining cards, and again, all cards will come up. Look at your remaining cards and send up any that are totally, completely, radically different from anything that's already up here. No way would they end up in a similar column. No, it can be, if you have two, you can do two. Oh, you have two? Can you? Thank you. Thank you. All right. And there'll be another round. All of your cards will go up. You don't want to use them all right now. Okay. No. Okay. Comprehensive, what are the key priorities for us for Happy Town to focus on as we collaborate to improve our community's health? Comprehensive aging services, healthy homes, complete streets, road safety, thinking across systems, stakeholder communication, families that work, access to health facilities, build community support for unfunded health care, build community and raise awareness through recycling, housing quality and quantity, and public safety. Do you see any new pairs? And we can go to clusters now, more than just two. Okay.
And housing.
Okay, hold on. What was, you have a clarification?
Families that work.
Families at work. What team turned this one in? And your intent, please?
A lot of the difficulties have to do with difficulties with
Okay, so healthy functioning as opposed to employed families. Okay, okay. Thank you for that clarification. Okay. So others that go together. Claire, what team did the complete streets? Can you explain your intention, please?
Yes, it's the streets, the roads, the sidewalks, the background, the crosswalks.
Accessible to all? Yeah. Yeah. Okay. Yeah. The healthy homes?
Oh, is that healthy homes?
Yeah. You don't want clarification? Or you do? Can we have clarification on that? What team? Okay. Help us understand, please.
So healthy homes in the sense that home is free of toxins, a positive environment, and safe and structurally intact.
Yeah. So that's structural and this is emotional. Okay. Yes, ma'am. Mm-hmm. We could. Okay. Yes? What team did that one? Comprehensive aging? Can you help us understand? You just are thinking at such a creative level. We need your help.
So support for aging populations that are homebound or homeless, emotional support for aging who are also without a family support, that they have access to transportation to medical care, that they have equal access to community supports.
Does that clarify? Okay. Any others that you need clarification on? Okay, so what are you have a... Okay, build community support for unfunded health care.
Clarification on thinking across.
What team did this one? Okay.
So thinking across systems, a lot of times.
Wait, can you use the mic, please?
Sorry. A lot of times with public health, we're focused on healthcare and healthcare systems and not thinking about the other systems in our communities that can engage in public health prevention. So transportation, parks and rec, public safety. They have a role in public health, and we often don't engage and think across those systems.
So this may be something that like is an umbrella over everything as opposed to one of the categories. Does that, okay?
I just need a clarification for access to health facilities. Was it physical access or is it just accessing
What team did this?
to
Okay.
care, access to care?
It was both. So access to facilities and also access to quality health care. So both.
Okay, I'm now the mic mover. So what, any others, do you see any others that go with anything? Okay, Donetta, you're the mic mover. I think we're done, but if we need,
What
okay.
about stakeholder communication and then moving it in with building community support on healthcare part, right?
So you would have these as a separate category or with here? What was the stakeholder communication? What team did that? Oh, okay, and your intention was for all this?
Yeah, and to find out what the issues are beyond just what the public health folks think about it.
Okay. 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 All right. So now, let's real quickly, what is this one about? Public safety, road safety, complete streets, lack of public transportation. What's that about? Just a quick tag. What's the theme?
Safety.
Safety? Let's look at this one here. Comprehensive mental and physical health care, access to health facilities, comprehensive aging services, build community support for unfunded health care. What's this one about? Access to care. Okay. This one here, healthy homes, housing. What's this about? Built environment. And we're going to refine these in a minute. This is just a holder. Decrease obesity, childhood obesity, obesity.
Obesity.
Can I offer an additional thing?
We're going to spend more time getting a lot more stuff. Teen pregnancy, parental readiness, families that work. Families. Increase exercise opportunities in the community, access to parks. Do we want to just move it now, or do you want to wait and see what else comes up? Okay, let's wait. But the beauty of the sticky wall is we can move them all over. Improve nutrition knowledge, accessible, available fresh fruits, vegetables. This education, raise education level, improve health, is that sort of with this top one here? It's this, all the big systems, the big public health. Build community and raise awareness through recycling. Okay.
Yeah, I was going to say policy. Yeah, that's a good one.
Okay. So now what I want you to do is look at your remaining cards and put the symbol of the column that you believe they best reside in. And if you want to get up and move, bring it on up. And if you want to just pass them up, that's okay too.
This one would fall under the big. I think this one falls under the big.
Put the symbol on it.
There's no symbol. There's no symbol. Thinking across.
Oh, okay.
Next would be families or.
All right. You can put them up, or we can do it together. All right. This is what Happy Town is all about.
Happy Town's so happy.
I told you.
Come on now, take it down and put it back up.
I guess closest, but it's not really.
All right. Do we have all the cards
It
up?
has to do with families too. I don't know, what do you think?
You want to? We'll put it over here, and after we have the conversations, we'll be able to figure out. Okay. So now what we're going to do is spend time really having discussion about what is this theme and what is the answer to this? What is the key priority of our community to focus on as we collaborate to improve our community's health? What is this key priority? What is this key priority? And here's how we're going to do it. I'm going to read through all of the cards. You'll have a chance to get additional clarification. It could be when we see the columns that you think, one of these doesn't really live here, and we can take it out. And then I want you all to offer up a 3 to 8 word, actually, it may not need to be 3 words, but an answer to what is this key priority, okay? So I want you to come up with the key priority that we're talking about here. And here's how I want this exercise to go. When you hear, just shout out, this is what it is. If you don't think that really captures it, if it's missing some dimension or some nuance or some richness that you feel is represented in this column, rather than talking about why that offering doesn't work, just offer another one. And so hopefully, usually, this is a fast-paced building on each other's ideas. And then we need some signal from you all as a group for when you hear what really works. Some people do jazz hands, some people do thumbs up, some people, I was at Tufts University and they did elephant noises, you know, whatever. So what is your public health signal? You want to, is that, are you willing to do that? So, and, okay, so.
Because you know we're in the Longhorns. Is this Longhorns, right? Oh, we're at UT? No, we're at UT. Who's the Longhorns? I don't know.
Okay.
UT?
This is Longhorns.
Oh, this, I'm sorry, I don't know the symbols. I'm sorry, I'm from Kansas, okay? I'm sorry.
Okay, so can we say that this is our, we're ready? It's exercise, you know, we want to be active. Okay, now here is what we're going for. We're going for something that you can all really support as one of your key priorities, okay? It's not, I had a better idea, but I can support it, okay? So it doesn't have to be your top, your favorite, but it has to be something you can live with and not go out into the parking lot or into the breakfast room and say, that was so bad. Yeah.
Should we look to see if we want to combine groups?
That will happen organically, so we'll do that. Okay? So are you ready to go? So we're going to start with this big sucker because there was a lot of energy behind it. Here are the new ones. So what are the key priorities for Happy Town to focus on as we collaborate to improve our community's health? Access to care, not just disease care. Access to care. Lack of MCH services. Maternal child health services. Health, mental specialty, underinsured Medicaid. Access to care. Build community support for unfunded health care. Comprehensive aging services. Access to health facilities. Comprehensive mental and physical health care. Do you need any clarification on any of these? Do they all go together? So what is this key priority? Access to quality care? Yes, sir?
I disagree.
Okay, just give us another suggestion. Do you have another idea?
Oh, instead of access to care?
Uh-huh.
I guess I am in favor of better families.
No, we're not saying what is our top priority. We're naming these right now. We're going to prioritize in a minute.
Oh, okay. So you don't really care what I think about that?
No. What I care about right now is that the name that you select captures what this priority is. And then we're going to go for the prioritization.
Access to care, girl.
Access to comprehensive quality care.
Across the lifespan.
Access to care. Is that it? Okay. Access. Do we have this? No, we've got a big head shaking. We need to keep going.
I think it's more of a comprehensive healthcare delivery system that we're trying to capture.
So the key priority that we want to focus on is a comprehensive healthcare delivery system?
No.
No, we're here in access.
I think when I hear healthcare, I don't always, I hear the medical model. And so I like the idea of access to comprehensive care across the lifespan, more of a holistic, so we're looking at preventive and everything. How about whole health? Whole health. Whole health.
It's not just physical.
Comprehensive care. I'm just writing this so we can see it. I've got more yellow paper. Access to comprehensive care. Okay. So access to comprehensive care across the lifespan. Does anybody have another better suggestion?
What did we comprehensive health?
Do we want comprehensive health care?
I think the problem with health is just the medical model. But health is not only medical.
Yeah, I say care is medical too, so that's how I look at it.
So do you want me to add health or not?
I think yes.
Okay.
Yeah, health services. I think health services.
Constituents who live in Accreditation.
So access to comprehensive health care across the lifespan?
Or if you do health services, it's more comprehensive. I like the word service.
Do we want access to comprehensive health services across the lifespan? Can I ask you to write that so we'll move on? It's just health. Yes, clarification.
Access, are we meaning access?
Wait, we need one voice at a time.
Are we meaning access in terms of only people coming in to receive care, or are we talking about a healthy system of care where there's some policy that creates access, that creates services, that creates...
I'm seeing sign language here that is,
Yes, can I say that would be my vision, that it doesn't just stop in building, that it goes across everything. Everything out, it doesn't encompass the policy. You can't just have that without policy.
so can we live with that? Access to comprehensive health services across the lifespan?
I don't like the word access.
I don't like the word access. To me,
So let me ask you this. If we are identifying key priorities for us to address comprehensive health service, we could get rid of access to.
I think access is important because you can have the most fabulous services on planet Earth in your community. If the people in your community can't afford to use them or can't get to them, it's meaningless.
Okay, so we want it, yes ma'am?
How about accessible?
Accessible, comprehensive health.
to me, it indicates only how someone comes in or comes out of the system,
Not the quality of care in the system.
right? Not the quality of care or the structure of it.
Comprehensive and quality.
Do we want to high quality comprehensive?
How about comprehensive quality health?
Or just quality care.
Yeah, quality.
So access to quality comprehensive health services across the lifespan. Can we live with that? Are we, well, there was a suggestion that we drop access and there were huge no's from this side of the room. Keep access. So can we live with this? Okay. Yeah. Okay. All right. Good work. And usually the first one is the most difficult. And the conversation that you had as Happy Town was an important one to hear your different perspectives. So let's go to this one here. We've got trails and sidewalks, lack of public transportation, complete streets, road safety, public safety. What is that key priority for Happy Town to focus on? Do you need clarification? I'm sorry.
I'd like clarification on the definition of public safety, because that in a lot
What team did this one? And can you help us?
Yes, we were discussing how people need to feel safe, children, adults, people of all ages, so that they can get outside to, be physically active.
Okay. You're not going to get shot if you're playing in your front yard.
Right, because that is a real, and even the perceived fear
Right.
that can happen.
Okay. So what is this key priority?
Moving safely through your community.
So the key priority is moving safely through our community? Does that capture it? You have another idea?
No, but I feel that captures the activity and the intent of this.
Because it It's about people.
Okay, so do we have this? Okay. No?
It doesn't cover the lack of public transportation.
But she said, they said moving.
Moving safely throughout our community. So you would, public transportation would conceivably be a component of everybody being able to move. Yes?
I think the trails and sidewalks addresses more physical fitness than safety.
Okay, so we can move this to over here. Okay.
On that one.
What team? Oh.
That one at length because it really comes under three categories. It comes under exercise and activity, it comes under built environment, and it comes under the safe transportation system.
Okay.
It encompasses all three, so it could really go in.
We could have 3 cards saying the same thing. Okay, but you wrote this and you want it here.
Right.
So what?
Because having safe places
No.
to be on the trails and
Right.
sidewalk is a precondition.
Okay, so what are we calling this? Moving safely through our community? Does that work? No, it doesn't. So give us another idea. We don't need to talk about why it doesn't work. We just need more ideas.
Injury prevention.
Injury prevention. Okay, so let's get another one.
Engaging the community in building safety.
Engaging community in building safety.
Can we move lack of public transportation policy?
Okay. Does that help? Sometimes when it's difficult. So now we've got public safety, road safety, complete streets, trails, and sidewalks. What?
I feel like moving safely fits now.
Moving safely through our community?
Yeah.
Okay, this one turned out to be a big one instead of just one on the top. Thinking across systems, stakeholder communication, education, raise the education level to improve health. Education level, STDs, HIV, chronic diseases, engage the whole community in public health.
The education, with raise the education level, kind of goes with access to quality education for families.
Okay. So then, with that one gone, what are we talking about here? So what is our priority?
Communication and education.
Community connection, community education, and communication. Let's hold off and stick with this one, and then we'll deal with those when we're at the end, okay? So where do we go?
You're over. There you go.
Community engagement? Does that? Okay. Are people okay with that? Okay. So now, what did we call this? Community engagement?
Can we talk about
The
whole
key
community engagement?
whole community engagement?
Wait, I'm sorry, clarification. Why do we move health education?
Because
It's because it's generally provided as part of the healthcare system. So it can be part of the educational system. It's another one of those that could have 3 parts or more.
what team did this one?
We did.
So are you more comfortable with it over here?
Well, my group is saying no, but let me tell you what my intent when I thought health education, I was thinking of going into communities and educating them and not just, I guess you could put it over there. I don't know.
Then it looks like it needs to
I
go
would
under
struggle with that
families
because I'm
under
thinking
the-
of going into
That could be
communities.
community
And
engagement.
yeah, I don't.
Okay, so we can leave it here and call this community engagement?
Yes.
Okay, do I see?
I just think health education is something that really does fall under comprehensive or under education. I think those 3 items there are very, very those are broad. That's 100,000 for
So these are,
That our statement for this should be functional communities or functional systems within the community.
functional systems within the community. What is our key priority for us to focus on? Functional systems within the community? Communication among community systems? I didn't hear whatever. Ask people of Happy Town.
But that means, but doesn't it go both ways? I mean, shouldn't we be learning from everybody that accesses the system?
Okay, so let's just get another name suggestion for this.
I
Uh-huh.
think really what you're talking about is the stakeholders, because that could be your law enforcement, that could be anybody. To me, that then doesn't, sometimes people think the system.
So is this community stakeholder engagement? No.
Communication too. It's more than just a stakeholder.
Okay.
Community is a stakeholder, but that's not the usual.
Okay.
How about engaging the community in public health system?
Engaging the community in the public health system.
But I think the problem when you use public health system is that those other entities like public safety, transportation, parks and rec get left out of the conversation.
Okay, how about engaging the community in
System integration.
System integration. Engaging the community in system integration. Engaging the community in comprehensive planning. Engaging the community in community conversation. Cross-sector engagement. What's the key priority for us to focus on? Cross-sector engagement.
How about planning and collaboration?
Yeah, systems planning.
Systems planning and collaboration.
how about engaging the community in improving our health?
Engaging the community in what we're trying to do is come up with priorities that will do that. So theoretically, every single one of these should be about engaging, collaborating to improve our community's health. But what are the subsets that that there's been energy behind that we want to prioritize? So what was systems planning and collaboration? Good job. Good conversation. Okay, so let's move to this one here. We've got lack of public transportation, air quality issues, increased community building events such as arts and culture, build community and raise awareness through recycling, smoke-free ordinances. What is that key priority that you might focus on?
Change public policy to improve health.
Changing public policy to... Policies to support a healthy community?
Yeah.
Seems like it focuses though on environmental quality.
We've got...
Quality of life.
So do we want to change it to be policies to support environmental quality? No. Leave it broader? Healthy community? Where is, so you would move healthy homes and housing quality to there? Yeah. See how this happens?
They say no.
They say no? Okay. Well, let's leave it separate for a moment.
Without public policies to affect those, they're not going to get changed.
Okay. Well, let's just hold on. Yeah. Okay. So let's move to this column, we've got restaurant menus with fresh appeal, food policy, accessible, available fresh fruits and veggies, and improved nutrition knowledge. What is that priority that we might focus on? Uh-huh. Okay.
Well, what was the intent behind food policy?
What group did that one?
Several of us.
Okay. And does it make sense to move it over there, or? Okay. All right. So now we've got, this is all about healthy choices and nutrition. So improve community nutrition.
I guess I would like to do a mass grouping and do chronic disease prevention or something like that for obesity, exercise, activity, and nutrition.
Okay, I tell you what, that may be a second level thing that we'll do, but let's first name these. So this is improve community nutrition. Is that, okay, yeah?
That doesn't address the availability of it.
Okay, so give me a better title.
Well, and somebody correctly pointed out, public policy that drives everywhere.
Right. So what is this? Can we live with improved community nutrition as the key thing here?
Yes. Why not?
Okay, so now we've got decrease obesity, childhood obesity, obesity. What might we call this one? Obesity prevention and intervention? Is that what you?
That's a good one.
And this one, more green space, more physical activity, access to parks, increase exercise opportunities in the community. Yes, ma'am. So, sure.
I think the healthy homes and the housing quality, there is some crossover, but I see it also in different.
You can keep them separate. So, what do we want to call this one as a key priority? Improving the built environment. So this is improving the built environment, correct? Okay. Where did the trails and sidewalks go? Oh, here? Is that, are people okay with that? Okay. Complete streets goes over here? Okay. So, complete streets. Yes, ma'am.
Possibly consider, I was just thinking about improving the built environment. If you're thinking about housing, the quantity of housing and the quality of housing, that could go in and improve the built environment. But the healthy homes, they were referring to environmental. So I was still.
So do we, what would we call this now? So the key priority is safe and adequate housing? Safe and adequate housing? Safe, adequate, and affordable. Okay, and we've got two more here. We've got access to quality education, health education, STDs, HIVs, chronic disease, and education, raise education level, improving health. Do these all go together? Yes, sir. Okay. Quality education, what team did that one?
Did I?
And can you help us understand your intent?
That's a while back. I think I'm interested in making sure that the educational systems.
Yeah.
I'm interested that educational systems themselves are improved to a high quality level so that all objectives of education are better achieved.
Okay.
That's still kind of vague, but.
That's okay. So you're looking at it globally.
Yeah.
Yes, sir. So, given our previous conversation, would this health education with STDs and stuff be a part of the quality and comprehensive care? And then that makes that more, okay, so what are we talking about here? What's our key priority?
But I almost think that the quality education actually falls into policies to support a healthy community.
I think we're going to work on everything together later. I think that
Not necessarily.
Making a policy there with the education.
Okay. Okay, so what would this be as a key priority for us to focus on in Happy Town? Quality education? What? Quality education? Does that do it? Okay. Okay, so here's what we members, we have one last one, sorry. Families that work, and that was in an emotional sense and in caring sense, and teen pregnancy parental readiness. So what is this about in terms of a key priority for us to focus on? Healthy families? Support healthy family dynamics? Okay. You know, every single one of these could go under things to improve our community's health. We could have one column in all these cards, but this is our effort to see what themes have emerged, what priorities are here. So let's read through. What are the priorities for our community to focus on as we collaborate to improve our community's health? We need to think about supporting healthy family dynamics, obesity prevention and intervention, improving our built environment, improving our community's nutrition, moving safely through our community, quality education, systems planning and collaboration, safe, adequate, and affordable housing, policies to support a healthy community, and access to quality, comprehensive health services across the lifespan. Okay? I'm going to pass out an example of, just kind of pass these back, and I'll ask you to pass these back. This is an example. We're not going to document this because the content of what you're doing today is just illustrative, right? But this is how you would document. You emphasize to the group that you have not made commitment to any of these. These white cards, you have not developed a work plan. What you as a community meeting group have come to agreement on are these things at the top. So you want your presentation of them, your documentation of them, to really emphasize that there's something special about these yellow sheets, and that's where the consensus of the group came, okay? And then, but you want to capture in these exact words all of the things. Now here's a little insider tip for facilitators. I carry clear Scotch tape. You got them here? do your Scotch tape down here, you can accordion it up and then put it on the wall of your office or of your assistant's office or whatever, and type it up. Okay, any questions about that? That's just a little gift. Yes?
Is there a name for this facilitation method?
Yes, it's Technology of Participation, TOP, T-O-P. And that website I gave you earlier, ica-usa.org, that has a listing of trainings. We're actually doing one in San Antonio the 10th and 11th of October. So that's a possibility. Okay, now, good work, you all, and good conversations. But as we move to really coming up with priorities, as we had been suggested before, you need to think, and this is a model about organizational change. Or community change. And you need to think about 3 different dimensions in terms of any change really happening. You've got to think about, on a personal level, do I want it? Does Happy Town really want this? As what we're going to do next is move from these 8 or 10 or whatever key priorities to honing it down to our community's real priorities, okay? So what do I want? And you've got to make the undesirable desirable. But do you really want it? Are you motivated? And can you do it? You know, Kathy was talking about build on strengths and leverage opportunities. Don't just go for the deepest, darkest hole that needs to be filled if there's no way you're going to be able to get it. Then you need to look at the social arena. Are others encouraging me to do it? So if you're working in Happy Town Public Health Department and you all are passionate about moving safely through our community, but the entire community doesn't give a flip about that, what they care about is schools, well, you've got to harness peer pressure in order for anything to happen. And are others helping me do it? No matter how passionate, no matter how smart, no matter how committed you are at your health department, if you can't rein in other people in the community to really join this bandwagon, ain't nothing going to change in Happy Town.
What about the notion that there might be others who are obstructing progress, not just passively?
Right, right. And so you've got to find strength in numbers and knowing that there are those kinds of things. But there's motivation and there's ability. And then there are structural issues. Is the environment right for me to do it? Do we have the policies in place that can support it? Do we have the capacity to get the policies in place? Design, rewards, and demand accountability. And then the ability, does the environment support me in doing it? And sometimes you have to change the environment. So sometimes if what you're really going for is educational change and all of the legislative things and school board policies are not at all about educational quality, well, before you start being a Pied Piper for educational change, focus on the policy. So this is one model of looking at how in the world do we prioritize. So as you think about prioritizing things in Happy Town, you can think about those dimensions. What are other criteria that you would recommend considering as you work on priorities? Anybody? Or does that model kind of do it for you? Yes? Right.
So this framework really
Okay. So are we going to just sort of, for purposes of this exercise, use that as our filter for prioritizing? So now, so that we won't trip, I'm going to get rid of this. So now it's time. Each of you will be given the power of voice. And you get to choose one, put a red dot on the yellow thing for your top priority in terms of what we here in Happy Town ought to really focus on, given all the data that we've already collected and analyzed, this model of filtering about organizational and system change. Put a yellow dot on your second priority. On your third priority, put a blue dot, and on your fourth priority, put a green dot. You got it? So get off of your chairs, come on up, and let's see where this tagging, I'll give you stickers. So what you want to do is before you walk up here, have in your head, you know, what you're going to vote for so you won't be taking all the space at the wall. You put them on the yellow sheets. And when you're ready, come do it. So pass those to the right. Those are for you too. So when you know what your top priorities are, ooh, sorry. Thanks. Do you?
No, I'm in Houston. Thank you. Well,
Oh, I'm sorry. Does everybody have dots? It is a model, and no, it is by. I realize that I don't. I think after this I'll be able to find it. I think the guy's name is Denny. No, I think I can find it, and if not, give me your card and I'll send it. As I was doing it, it was like, shit, I don't have his name on there. Everybody voted? Put their dots on? I think this is on. Thank you, though. One of the facilitation ahas as I was handing out the yellow sheets, I should have not had red, green, blue, or yellow pages there. So, it's like stupid things they don't teach you in graduate school, but that are really important for this kind of stuff. So just take note, learn from this error. So as you look up here, remembering that red and yellow are the top priorities, do you see any that seem to really stand out as having a lot of support from our whole community, a lot of energy behind it, belief that this might be our priority? So are we willing to say that this is the top thing?
Yeah.
And maybe that produces the second of policies.
Yep, it is. That's number 2.
Okay, so this is 1, and then policies is 2. This one here?
Yeah, there's a lot more yellow on the policies. There's a lot more second choices on the policy.
You've got 1, 2, 3, 4, 5, 6, 7, 8 yellows, and 1, 2, 3, 4, 5 here. So this is number 2. And this is number 3. And then is there kind of a visual break? And we just want, if we try to tackle the world, nothing will happen. Do we want to say for Happy Town, for this next few years, we're going to really focus on those 3 things? And do they answer this question, what are the key priorities for our community to focus on as we collaborate to improve our community's health? Yes, no?
Just for sake of argument, those are huge.
I know.
I always like, especially when I'm working with a group, is look at the low-hanging fruit, because if they're successful early, the odds of them staying together is a little better.
So where do you see low-hanging fruit that we may, actually, you could take any of these concrete things. It's sort of like these are the mega things, and then the concrete deals fall underneath it. Yeah?
Crunchy, because they actually have found that people will make those selections over healthy food choices. That could potentially, you could evaluate their menu. It could be a real simple thing. They may not even have to be major changes, but just to point of decision of cueing, prompting, could help. And that can be low-hanging fruit.
Absolutely.
So one thing in terms of documenting this for a community, instead of just having like one table, what you might want to do is have these 3 have 4 rows, if you will, and have those 3 top priorities on the top 2 rows, and then have the other things underneath it. And what you might want to do at the next meeting of your stakeholders and of your community would be to say, so if this is what we're going to aim for, doing this, which of these do we want to start biting off? Or who has energy? There could be a coalition of folks who are saying, man, I have energy and I will lead this. I really am zeroing in on this. And then you've got other people who are doing that.
So this is more of a visioning, and then we'll go into
That's right. This is not an action plan.
Okay.
This is identifying our key priorities.
Just thinking, looking at 1, 2, and 3, that the other implication coming out of this is strategy is focused on community decision-making, elected officials. So they're the ones who do these.
Right.
But they get there because of community action, one way or the other.
And they need the people behind them in order to do it, because those elected officials ain't going to go against the tide. Other comments or observations? Yes?
Talk us a little bit about how you would, let's say we have these hearings and we have things hanging below. Can you talk us about how you would go through this chart? And then would you go through this chart specifically and ask them the questions?
Well, I think this is a chart that I teach a course on implementing strategic plans and implementing plans. And we're revising it right now. And this is something I've just come upon that I think is brilliant. And I am so sorry and embarrassed that when I made this chart yesterday, I didn't put the reference. But I will be happy to get to this whole group, the name of the guy. I think it's Denny. But they've written several books. Actually, I have the book in my car on my iPad. So I'll get you the author before I leave. But they've written a bunch of best sellers through the New York Times on organizational change and personal change. You can change anything, I think, is their, how to change anything is their newest one. And it's really about personal transformation, but it's the same model, and they've done a bunch of work on organizational stuff. But that's not your question. What was your question?
I guess to me, it almost feels like what we've done with the first level where we are is we've asked the personal questions in the community of do I want this? And so we've gotten to the do I want, and we've got this list. But then can we go back, I mean, can we actually go through this as a model and say, how do we do this? And make another, but maybe take all these things and say, what can we do?
That's a great idea.
Short term, middle term,
Yeah.
long term. And then how much, you know,
What do we need to change in order to make it work? That's a yeah.
and then you have doable things in the short, middle, and long.
That's fabulous.
Kind of a
Yeah.
solution maker.
Yeah. Yeah. Right. Yeah. 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 Great points. Actually, I'm going to Chicago in October to really work with this. So I love that idea, and I'll be with other people thinking together.
Because you may have some people that think some of this stuff is impossible, and somebody else on the other side of them might think it's really possible
Yeah.
because of what they do, and then you can start having a conversation.
Yeah, that's great. So, yeah, that's a great point. Other observations? Oh, we messed up again. I'm sorry. Oh, sorry. Okay. Other observations, comments? All right. Well, thank you for putting up with this and for your great ideas. We are supposed to reconvene at 11:05, and it's 5 till 11, so you get a 10-minute break, and we'll be back in here to do kind of a final wrap-up. Thank y'all. Again, welcome back. For those folks who were in this group, but also for both groups, you were introduced to this model of change, and Kathy may have known who it was by, but it didn't just come right from my head. Joseph Grinney is the author and speaker that I was first introduced to this by. He's written a number of books, and his latest one is called Change Anything, and most of his books are authored by the team of Carrie Patterson, Joseph Grinney, David Maxfield, and Ron McMillan. But in terms of this model itself, if you go to YouTube and do Joseph Denny and change, There's a really nice little video of him explaining this model. Grenny, Grenny, Joseph. And he's got a great big website. There's all kinds of stuff. The man's doing well.
My group didn't actually see that because I forgot to put it up.
Oh, so her group didn't see that. She forgot to put it up, but I'm sure you had a wonderful conversation anyway. So, okay. So I'm so glad. These are pretty wonderful, aren't they? So let's take just a few minutes to reflect. First of all, you know, the demonstration is over, and you all experienced it. What did the other room, what was the name of your community, or did you have a name of your? No name town. What was the name of the town in here? Happy Town, Texas. So, both of you experienced the methods, you participated fully, you came up with some priorities, but that obviously doesn't complete your process. You need then to establish goals and strategies and objectives with community partners. And we had an interesting beginning of a conversation in Happy Town about, you know, this model. And let me go over the model real briefly. You've got, in order for change to happen, whether it's individual change, losing weight, stopping an addiction, or organizational transformation or community change, you've got to think at the structural, social, and personal level, and you've got to think not only about motivation, but ability. And if you don't have all 6 of these quadrants in your favor, or if you can't get them in your favor, you ain't going to succeed with change. Okay? So at the personal level, do I want it? If you're talking community level, do you want the change? Are you talking a lot about complete street stuff when really all the community cares about is education? Do you want the change? And then can you do it? Can you really believe that you can make this change happen? At the social level, are others encouraging me to do it? Can you harness peer pressure? Can you be a Pied Piper and have more than just you or more than just your noble staff at the public health department be the cheerleaders? And are others helping me do it? Remember how Kathy said, don't just send out an e-blast and say, come one, come all, be a part of our process. You've got to really leverage connections, relationships, and build on them and find help and strength in numbers. And then structurally, sometimes you've got all the motivation, you've got the social will, but you've got social impairments that are just stopping you dead in your tracks. So is the environment right for me to do it? Are you holding yourself accountable, or are you just blowing smoke, right? Are you setting up structures for communication and accountability, et cetera? And then, does the environment support me to do it? Are there policies that we have to deal with before we can start looking at educational reform or street change, et cetera? So this model, that's the Grenny thing that I apologize, but my iPad could, so we're good. So we use that as a filter. And the discussion that we had in terms of moving to the next steps, we came up with kind of mega priorities and then had a number of second-tier, more specific priorities. And it was suggested that it might be a noble and useful exercise. Sort of what we did with the dots was, do I want it? And so to take your community through a conversation of can we do it? And then, are there others in the community willing to support it? And how do we make that happen? And how can we get the help that we need to do it? And what do we need to change in the environment to make it happen? That could possibly really lead to a thoughtful community dialogue that would get you to specific priorities and focus more than the global thing that we did today. But again, you all are working for accreditation, and you've got to come up with goals, objectives, etc. And so you all know the SMART deal. But I am always amazed at how groups of intelligent, educated people find this a useful and helpful directive. So instead of just saying, okay, so what do you want to accomplish or what are the goals? If you really get them to anchor themselves in setting SMART objectives, SMART goals, it's going to be time better spent. And you need to do that, of course, with community partners. Kathy, do you have anything to add in terms of next steps? Do you have any questions about all this? Yes?
Can you talk to us about what topics does to change the culture of your organization?
I love it when she talks about this.
So I guess it was probably, oh man, it's been a while now.
12, 13 years.
Yes, possibly 12 or 13 years ago that I was first introduced to the methods while our public health department was leading a community health improvement process. And we took advantage of Mary and other facilitators' services to help us do this step, actually. What are your priorities in your health department?
At that time, I worked with United Way. I wasn't in business for myself.
So we, when we got a little taste of it, we realized, oh my gosh, there are really amazing implications using these strategies throughout our work at the health department and also when we engage with the community, but even more selfishly, just individually, these techniques are really, really powerful and make for really meaningful, productive, action-oriented meetings. And so I said, you know, we need to have as many people as we can trained in these techniques because amazingly, even establishing meeting agendas, being purposeful about bringing people together, these are all things that you kind of just learn as you go through the process and as you use the methods. Having good conversations that actually result in change or result in a decision. So I would say at this point, everyone who works for me receives this training because they are people who are out in the community who are dealing with partners and stakeholders and moving projects forward and planning. So, and, you know, we hope that these techniques and these processes, we try to introduce them to as many different parts of our public health department as we can and making ourselves available to help others, other areas do planning. Because if you try to tackle planning without a process, you're going to get nowhere. I mean, it's true. So in terms of having a process and being able to help other areas of the department, that's where we've really tried to say, you know, take a look at this new process, take a look at this strategy. We can help you identify the priorities in your area, whether it's teen pregnancy prevention or, you know, kind of on the micro level within the program areas of the department. So I would say we're committed to it, and we certainly are continuing to try to have more staff trained every year.
Yes.
I actually come from Memphis, Tennessee as of recently, and we used this process with one zip code to change what was going on. Most of these people were not high school educated, but the dots, we did, and it appealed to everybody because they felt like they had a voice. And they could put themselves in which motivated the personal or the community abilities. It was fabulous.
Good.
Definitely.
My business partner is in Nashville, Tennessee, and so I wonder if it was her.
We've used it actually in our school district, VIC, and there's a company that comes in and she helps us prioritize to do our strategic plan. And we use the docs to prioritize. And it's a real eye-opener, I think, for everybody. what you're gonna do, because it's group consensus.
Mhm.
It's voting.
Well, and sometimes what happens when you look at what happened to the dots, and the dots are really not a part of the top methods, but it's a part of good facilitation tools. Sometimes there's nothing that bubbles up, and then you dive into that conversation. It's not magic. So let's spend a couple minutes just reflecting on what this experience was like. What were some of the concrete steps or specific things that you did in the demonstration or that you saw other people do? What did we just do for the last hour and a half? Brainstormed? You had small group consensus? You met and communicated with other people in your community? You prioritized? You learned about the sticky wall. Kathy, did you all talk about the mechanics of the sticky wall?
No.
Okay. So the sticky wall can be purchased at this website that I keep giving you, ica-usa.org. And it's called the Top Sticky Wall. And it is basically just 4 yards of nylon parachute material. So you could also go to Hancock's or a fabric store and ask for nylon parachute material, 4 yards of it. This is 60 inches wide. That's how it comes on the bolt. And then you get 3M. Elmer's makes it. Office Max makes it. 3M, trust me. Other stuff's glumpy and goopy and stuff. And you get a can of repositionable adhesive spray mount. And the first time you do it, you hang it outside because the droplets of this stuff make everything sticky. And you spray about a half a can on only one side. Instructions come with it if you order it from ICA. You can contact me if you make it yourself, and I've got some instructions I can send you. But you use about a half a can the first time. Usually, this is a cumbersome and elegant and really useful 12-foot easel that is sort of an erector set that I have. But usually, you've got a wall. Because these chairs, I mean, we could have used any of these walls, but because the chairs didn't really move around, we decided that we needed this. But in the other room, this was just positioned on the wall, which is oh so portable and wonderful. So that's that. So what did you like? What did you find yourself enjoying or liking about using these methods in the process as a participant? So she said, not allowing, in the ground rules, not allowing people to really dive into what they didn't like about somebody's idea, but just focusing on the positive and building on from that. Was that fair? Thank you. Yeah.
I felt like it was a very respectful process, and that everybody was heard.
It was a respectful process where everybody was heard. Any others? Yes, sir. Addressed effectively the impossible task of getting a group to make a decision. And I got to tell you, groups are so excited when they finish a 2-hour meeting and say, oh my, look what we did. They are grateful. They're willing to come back to the next time you have a meeting because there was purpose and there was resolution. So what about this process felt awkward or uncomfortable or gave you pause for concern? Yeah.
Public health is new. This was all their meeting, and
talk a lot about community, so to me that means we're going to be trying, we're going to try to do this on a much larger scale. So how does this work on a large scale? Let's try taking San Antonio 2020 of the mayor, this year-long process, where I'm assuming you just staff did a lot of type of work. Is it applicable and is it working well with really large groups of people?
When you do it with really large groups of people, you break it into smaller groups and distill it. And that's what they did with 2020. And they didn't use pure top methods, but they used a lot of the key elements. But they had lots of tabletop facilitators, lots of small group work. Yes, sir.
At first, I was fascinated with the discussion and debate about what words mean to different people, and that was useful in trying to come to consensus. Toward the end of our session, I think we were all a little worn down, and we reached consensus that we would say moving on. But I'm very new to public health too, and my image in general is that public health practitioners are very action-oriented. So I was just sort of fascinated by seeing these content rooms, discussion boards, but it was necessary.
Mm-hmm.
It was just sort of counterintuitive to me, all these action-oriented people so intensely debating meaningful work.
That brings up a really good point, and that is that the framing of this question, or of whatever question you're focusing on, is everything. I spend far more time, and actually on average it's 3 hours for every 1 hour of FaceTime that I have before a group, far more time making sure we have this right. I tell clients all the time, I am a great facilitator, but if we facilitate on the wrong question, it's going to be a waste of everybody's time. And it's going to be frustrating. When you pull together community, you don't want them to walk out of the room saying, so that was a waste. So really honing in, really testing that. And this question was given to us. I think it's similar to the one that you worked on last year. And so we didn't really struggle with it, although it worked. But that it really is a part of the process to make sure that the words aren't ambiguous or going to lead you to the wrong responses. Yes, ma'am.
What I liked that I could see that was kind of an issue that's probably pretty complicated to facilitate is the fact that there a lot of times we thought things went in one place and then we moved it around to another place. And so I think a lot of really, getting the ideas down is really critical in this process. You think it goes over here and then all of a sudden everybody goes, oh no, wait a minute, it's over there.
And actually, from a theoretical standpoint, all you're trying to do is get the group to see relationships and themes. And it's whatever relationship and theme the group wants. And sometimes what you end up saying is, well, let's make another card that says the same thing and put it in. And that can just unbreak the logjam. Yeah?
Do you ever see groups of elected officials making decisions like this?
Yes, actually, I've done work with the staff of a legislator and then with a whole team of people who were concerned about a particular issue coming to agreement. But an anecdote I'll share, when I worked at United Way, and I was there for 14 years from the time we moved into San Antonio until I started my business. But United Way of San Antonio at that time really was a place where all the male power brokers of the city were on the board and really engaged. And so the CEO, understandably, didn't want any weird stuff going on, didn't want any touchy-feely, goofy, social worky stuff happening. But he also had worked with me long enough to trust me, and there was a really critical conversation that had to happen. And so he walks in the room, and I had the sticky wall up. And his face just went pale, and he said, "Flanagan, what in the world are you doing here?" And I said, "Trust me," I said, "if you get any negative feedback, you'll never see the wall again." After that day, Bill Greehey, head of Valero Energy at the time, big community leader, Tom Frost, head of Frost Bank, would say, "Let's pull out that sticky wall so we can throw our ideas up and move them around," because it's efficient and it's authentic. And so it was like, well, so let me ask you this. What's it going to take for you in your community to make something like this happen? What do you need? Okay. A personal invitation. Yeah.
You also have to get some key power brokers on board.
You got to get key power brokers involved. Yeah, and Metro Health has really begun living that. There was a hand, yeah.
I think there has to be a consensus in the community that group decision making is okay.
Good point.
Otherwise, they'll never come.
Yep. Yeah. Well, you had one more?
Actually have enough experience with you to really lead the group well. I mean, I don't know, I would think it would be difficult to do the first time in each group with very thoughtful people. You want to have some experience in practice and feel like you really could lead with that sort.
Yeah. One of the things that has been really neat with Metro Health, and also people working in rural communities from dishes, who keep coming down. There's just this pipeline. I don't know if any of you know Susan Sin, but she took the training from me years ago, and she keeps sending her people who are out there doing work in rural communities. And so they have a cadre of colleagues within their organization who, when they're trying to design something, can call each other and support each other. And I know that you all have done that a lot. So it really helps. Well, I thank you for the invitation to come, and I am so grateful to Kathy for coming, and to Metro Health for underwriting her coming, and for what y'all are doing. Thank you. And you have instructions for lunch.